Thank you everyone for joining us this evening. I want to welcome you to this evening's expert education presentation from the Sashbear Foundation. I am Doreen Hindman. I'm the program manager here at the Sashbear Foundation, where I coordinate family connections throughout Canada. These expert education series presentations and other programming that Sashbear provides to help provide skills and hope for families across Canada. The Sashbear Foundation is a Canadian charity recognized nationally and internationally as a leading voice for families impacted by emotion dysregulation, suicidality, and related mental health challenges. Now, you will know that yesterday was Giving Tuesday, and as a registered charity, the donations at this time of year, or really any time, are particularly important to us. And if you have already made a Giving Tuesday donation to us, we want to thank you so very much. We had an incredible response this year. And remember that you can also choose to become a monthly donor. Just a small regular donation can make a really big difference as we continue to provide support, skills, and education for families to support their loved ones. So I'm joined by Lynn Curry, who is the co-founder and president of the Sashbear Foundation. Thank you so much for being with us tonight, Lynn. And also with us are Sandra and Tricia, who are both volunteers with the Sashbear Foundation. And tonight they're going to help me keep an eye on the chat and on the questions as they come in. And I would now like to introduce our special guest speaker, Dr. Shelley McMain. Dr. McMain is an associate professor in the Department of Psychiatry at the University of Toronto in Canada. She's head of the Borderline Personality Disorder Clinic and a clinician scientist at the Center for Addiction and Mental Health in Toronto. She's a practicing psychotherapist, a trainer, educator, and researcher. She's a certified dialectical behavior therapy individual and group therapist, and she currently serves on the International DBT Strategic Planning Committee. Shelley's research interests include personality disorders, dialectical behavior therapy, emotion regulation, suicidal and self-harming behavior, and substance abuse. She has authored more than 60 articles and chapters, and she has a book forthcoming. She is the principal investigator of a large research study that was designed to evaluate the clinical and cost effectiveness of DBT over 6 months compared to 1 year for the treatment of suicidal individuals who had a diagnosis of borderline personality disorder. Shelley's work has led to numerous research and teaching awards, including the Distinguished Research Award from the European Society for the Study of Personality Disorders, the Scientific Paper Prize from the American Psychoanalytic Association, the Research Award from the International Society for Improvement, and teaching awards from the Department of Psychiatry and the Faculty of Medicine at the University of Toronto. In addition to all these incredible credentials, Shelley has also been a supporter and a friend of the Sashbear Foundation for many, many years. We are honored to have had her speak at our Sashbear Walk and support us in innumerable ways over the years. We are honored to have her support, and we are grateful that she is able to join us this evening to share her expertise and her breadth of experience with us. Welcome, Dr. McMain. Thank you so much for being with us tonight.
Thank you, Doreen, and thank you, Lynn, for inviting me here, and everybody else who's really doing some amazing work in this organization, and I think helping to bring this information to people internationally. So it's a pleasure to be here. I'm just going to share my slides, and I will. Hopefully you can see these slides. So my presentation today is going to be focused on borderline personality disorder and substance use. And I'm specifically going to be focusing on information that I hope will be really relevant and helpful to families. And just by way of declarations, I want to acknowledge I don't have any conflicts to declare. In terms of my plan for this presentation, what I'd like to do initially is discuss the co-occurrence of borderline personality disorder and substance use disorders so that you have an understanding of how these disorders co-occur. I'll then focus a little bit on some treatment considerations. And then finally, and really sort of the bulk of what I want to get into are some practical strategies that I hope may be helpful for families. So let me begin just to set the stage by saying a little bit about the co-occurrence of BPD and substance use disorders. So we know that borderline personality disorder is highly comorbid with other health problems. And what we also know is the highest rates of co-occurrence of other disorders include mood disorders, anxiety, and as well substance use disorders. And in fact, substance use disorders are amongst one of the highest rates of co-occurrence. When we look at samples of people with borderline personality disorder, and this data is based on a recent meta-analysis by Trull and colleagues, so we see that over half, so 57%, 0.4 of individuals have at least one substance use disorder. So it's quite common amongst people with BPD. 48%. So again, almost half would also meet criteria for an alcohol use disorder, and about 38% would have a substance use disorder. Now, there's a lot of good reasons why, of course, people with borderline personality disorder may struggle with substance use disorders. We know that BPD is a disorder that's highly associated with problems with the regulation of emotions and impulsivity, and emotion dysregulation and impulsivity figure also in the etiology of substance use disorders. Certainly we know that impulsivity can lead to a lot of negative consequences, and this can include substance abuse and substance dependence. And as well, we also know that an etiological factor includes emotion dysregulation, and that it plays a key role. For example, borderline personality disorder, it's well known, is associated with very high rates of negative affect and unstable moods. And we know that substances work in the short run anyways, in terms of modulating aversive emotions. So if I drink alcohol, I may be able to self-medicate an otherwise intolerable emotional state. We also know that borderline personality disorder is highly associated with chronic feelings of emptiness and also difficulty with inhibited or suppressed emotions. And we know that substances, drugs, alcohol can work in the short run anyways, because they make people feel better. Often they can bring up a euphoric state, and that's something that is desired. So there are good reasons why there's high rates of overlap between the disorders. I want to say a little bit about, well, what do we know about the characteristics of people who exhibit or have difficulties with comorbid substance use and borderline personality disorder? Because I think understanding these characteristics is important in terms of understanding then how to support your loved one who's struggling with these comorbid disorders. First off, it's normal for people to be ambivalent about change. Substance use is highly reinforcing. It is a way to cope, maybe a way to cope with problematic emotions. And ambivalence is normal, and it's normal for then people to be reluctant to engage in treatment, or perhaps to be uncertain about whether or not they're going to stick it out in treatment at all. It's also normal, if you're engaged in substances, to be engaged in an environment that tends to be using substances. So it's normal to be spending time with other people who are using drugs or alcohol. There's less stigma, there's less shame if you're around other people that you're not going to be judged by. So that's normal. It's also normal to lie and to minimize your problems. lying can be a really probably helpful way to avoid facing the consequences of a problem. It can also be a way that can protect somebody from loss of a relationship. If I lie about what's going on, then my loved one won't lose me because they won't know what's really happening. So it's all normal to lie and to minimize, and certainly lying and minimizing problems can be, in the short run anyways, a way to deal with high levels of shame. And of course, denying a problem and not engaging in treatment is also, a pretty common way when people are in the grip of addiction. They might convince themselves that, they've got things under control, or maybe they don't need help, or they can manage things on their own. And again, these are all ways that can help people avoid dealing with their own shame and their own guilt. In DBT, in fact, one of the phrases that's used to describe people who are substance using, along with BPD, is that they're butterfly clients, because they tend to float into treatment and then escape treatment and often disengage from treatment. And that's one of the challenges that clinicians need to be addressing. And I'll talk about what are the implications of that then if you're a family member with a loved one who's struggling with these difficulties. It's also, I think, clear that the effect of substance use on personality disorder, BPD expression, can be one that just exacerbates existing symptoms, and it can contribute to the chronicity of problems. BPD alone is a disorder associated with mood lability, but when you add substances to this mix, you tend to have increased mood lability, and this may translate to higher levels of hostility than as compared to non-substance using counterparts. People may be more likely to act out physically. They may be more prone to cut themselves off from others and withdraw from family members or friends because of high levels of shame. They would likely be spend more time seeking out substance use and stop participating in activities that they once enjoyed. It might be difficult to talk with other people and talk about how they're feeling and what they're thinking. And it can be difficult just engaging in simple decisions or setting goals when you're using substances. It's difficult to think clearly, never mind the impact on your mood. It's, of course, common to be missing school and missing work. Certainly, the use of substances in the context of BPD, and even just alone, not in the context of BPD, can have a huge impact on just basic needs. If you're spending a lot of money on substances, well, that can interfere with your ability just to pay your rent. And that can lead to evictions, and that can lead to a lot of other problems. Some people might end up engaging in criminal activity, such as robbing or petty theft or prostitution, not uncommon, if they may be looking for ways to raise funds in order to buy substances. People may be much more likely to be at risk of losing their housing due to eviction. If their decision making isn't great, they might open their homes or their, places to other people who are also involved in substance use, and then be unable to maintain that home. They may have difficulty feeding themselves, bathing themselves, and it may be difficult even just to maintain good hygiene. Certainly all of this can impact social relationships, and somebody who's dependent upon substances is going to be potentially more likely to be involved in engage with other individuals in which social relationships are just a bit more harmful. all of these consequences of, certainly if you have a loved one who's struggling with these problems, is just very challenging for families to have to deal with. And I think families can be significantly impacted in a lot of ways: emotionally, financially, physically. Usually there's often a pressure for increased caregiving responsibilities. There's often a greater negative impact on social life. Maybe as a family member, you're concerned about leaving your loved one alone. You're worried about the possibility of them taking harmful drugs, or perhaps you're worried about them getting involved in dangerous or criminal behavior in order to support their illegal drug use. Or maybe you're concerned about, serious self-harm. They might be somebody struggling with suicide, and with substances on board, that will make them at higher risk. So as a family member, I think often people have the experience that they're constantly watching out for their loved one and really trying to deal with the impact of this illness. I think a lot of family members, find it very challenging in terms of dealing with their own anxieties, fears, and guilt, and may have tremendous difficulty with feeling angry with their loved one, and also very powerless to change the situation. Certainly, I think to the extent that these emotions are denied, it can lead to a feeling of exhaustion and depression and isolation and just greater hopelessness. I think a lot of people find that it can be difficult just to care for your own emotional and physical needs. Maybe you feel like you don't have the time. You feel guilty. You're spending a lot of time trying to help your loved one. So this makes it very challenging for families. And I want to talk about what are some strategies you could use. But before turning to strategies, I want to say a little bit about what do we know about the treatment for people with comorbid BPD and substance use. Now, there are several approaches that can be taken, and I want to talk about what are some general approaches and what's recommended in the literature. First off, there's what we refer to as an integrated approach, and this is where the substance use and the borderline personality disorder is addressed in an integrated fashion. And, really ideally, this would mean in the same treatment setting by the same clinicians, by the same team. And the real benefits of this are that, the client is getting consistent care and a coherent treatment plan. So this has a lot of benefits. It's not always what is possible. Sequential treatment is often when the client who's struggling with BPD and substance use might end up having one problem treated first, and typically would be the substance use disorders treated first. And this would be recommended when the substance use disorder is very severe and when stabilization is required. Now, the drawback of a sequential approach is that, the untreated problem, and so the borderline personality disorder issues and the emotion dysregulation are continuing to impact the substance use disorder. And so it's a challenge then if you're treating one, given that the substance use disorder and the borderline personality disorder are interrelated. Finally, the third main approach that's generally used is what's referred to as a parallel approach. And using a parallel approach, both problems would be treated at the same time, but they would be treated by different professionals or teams. Now, drawbacks of the parallel approach are the fact that they're not integrated. It's not a cohesive package. Oftentimes, treatment providers aren't talking to one another. I think other challenges is that in some programs, and this may not be true of specific specialist BPD programs, but in some programs, particularly mental health programs, they may exclude people with substance use problems. So the downside is really a lack of integrated care. Now, if we look at practice guidelines for borderline personality disorder, and there's several international practice guidelines, and I was reviewing them prior to this talk just to relook at what the guidelines recommend around substance use. The recommendations are, again, if you have an individual with a very severe dependence on alcohol or drugs, the recommendation is that it's best to refer that person to an appropriate substance use disorder service. And this, I think, is generally what's practiced. At the same time, the care should be coordinated with treatment for borderline personality disorder. You know, when I talk about a severe dependence, I'm talking, you want to be thinking about, you know, severity in terms of the frequency, in terms of the intensity, the type of substance the person's using, and how much is it impacting their personal and their social functioning. And also just medically, if the person requires a medical detox to support their withdrawal, then it's going to be best done in an addiction facility or substance use disorder treatment. Now, it's going to be really important to monitor what the impact of the treatment is, because if the person's in a substance use disorder treatment, but they don't seem to be making gains, and certainly I've seen this before because, you know, you've got other issues that aren't being addressed, then it's important, I think, to discontinue the ineffective treatment. So specialist treatments certainly do need to focus on the influences of substances. And for people with moderate to mild substance use disorder problems, I think it would be important that they are engaged in a BPD specialist treatment where there is one available. And that really should be focused on the impact of the substances and how these problems are interrelated. Now, there's not a lot of research on treatments of borderline personality disorder and substance use disorders. There are a few well-controlled trials, but the evidence base is still quite limited. So let me shift at this point, and I want to say a little bit about some practical strategies that hopefully could be helpful if you're supporting a loved one who's dealing with substance use problems and borderline personality disorder. And I think there's several ways that families can provide support. And I want to review 6 specific ways that I think could be helpful. I think one thing is it's important to prepare for crises. So it's important as a family to work with your loved one to develop a coping plan before the crisis actually arises. And this means creating a plan that's going to be tailored to the needs of the person that's in your family that you're trying to support. You want to make sure that your loved one is actively involved in this planning process and that they're participating in all the discussions, all the decisions, and that you're really listening to what are their preferences. As part of this plan, what is, I think, really important to understand is what actually is most likely to trigger them. So identify triggers. Understand how are they most likely to respond if they are triggered. You know, for example, maybe you have a conversation about perhaps, you know, what happens if they have a relapse or if they have a lapse and they end up using after a period of abstinence. How are they most likely to respond? You know, maybe they may get very judgmental, very depressed. They might withdraw. They might beat themselves up for failing. And you want to understand then, how could you help them in this situation? So You want to ensure that you've got some idea of what could you do in response to that situation. You especially want to consider what are situations that may be very high risk. So, perhaps a high risk situation might be somebody who's really struggling with urges to use a drug that they hadn't used in months. Maybe they've been abstinent from using opioids for several months, but suddenly they notice they've been triggered and their urges to use are much more intense. And that's a higher risk situation because they no longer have the tolerance that they had for using opioids. So you want to, as part of your crisis plan, determine what supports are going to be available in the event of a crisis. And I think here it can be helpful to develop a crisis toolkit. And I would suggest actually writing important information down on a card. It might include having some type of, self-calming measures or distress tolerance kit that could be used. I think it's helpful here to know what are the crisis supports in your community. Which emergency room might be well equipped to deal with somebody with BPD and substance use disorders, or is there a detox in your area? I would also think as part of this plan, if your loved one is involved with a healthcare provider, it's important to determine, is there a healthcare worker who could be available for crisis support? So what's not generally helpful is to have multiple people involved in responding to crises, but having in advance identified who is the go-to person who could assist with crises will be most helpful. And they should be, of course, part of the plan. I think as well, especially when you're dealing with a problem like substance use, it's important to know how to administer first aid. And this means learning CPR. It also means knowing how to administer naloxone. So, which is available, naloxone kits are available in many pharmacies. Probably as part of the crisis kit, for anybody who's using opiates, you want to make sure that they actually have access to a naloxone kit, and that they know how to administer it if they're with friends, or if they're using themselves, that they have friends who know how to administer it with them. Now, if it is a crisis, so this is what you do prior to the crisis, but if you are in a crisis, a few tips on how to respond in the crisis. First off, stay calm. Don't shout, don't argue, not helpful. First response is to move in with some validation and empathy, and then make some suggestions on how to cope. Something might be just starting off with saying, I can see it's really difficult. I can see you're really disappointed. I think it's important, radically accept emergencies can't be avoided. And radically accept that you don't have control to change all things. There's things you cannot control. I think it's important to be aware of what are your personal limits. There may be things that you know already, they're just beyond your limit. Take suicide threats seriously. When you're dealing with somebody who is also using substances, the risk of suicide is 3 times higher than for somebody who's not using substances. If necessary, you may need to go to the hospital, and you also might need to call an emergency line, so 911, if it's necessary. So these are all things to consider if you are in a crisis. Now, second, I think, strategy that can be really helpful for families is to move in with a lot of empathy and a lot of understanding. A lot of what I described earlier in terms of the behavioral characteristics of an individual who's struggling with substance use and with BPD is there's often very high levels of shame. And so criticizing somebody when you're frustrated isn't helpful because it actually just increases shame. It increases secrecy. It isn't helpful in terms of your relationship with them. And ultimately, being criticized just increases the odds that the individual is going to end up using substances. So validate by highlighting anything that you can see that makes sense. And it may be, which would be very normal, to validate the fact that it is disappointing to relapse. Even if somebody says they don't care, it is disappointing, especially somebody who has been trying to quit. And it's not uncommon for somebody who's been trying to quit the moment they relapse to say, I didn't really want to stop anyways. It's what you wanted me to do. It's normal to deny that it's a problem. So moving in with validation, especially in response to relapses, can be helpful. Validating just how difficult it is to resist urges, extremely difficult. And it may be just saying, yeah, of course. Substance use disorders are chronic and relapsing. And the recovery process isn't smooth. It's not a straight line towards abstinence. It's normal to have slips and relapses. And it's important when that happens to respond with a lot of cheerleading and a lot of encouragement. I know it's disappointing. You can do it. Stay with it. We're here to support you. I know this is hard. It is so hard. And, slips are normal. It's also, I think, important to recognize and validate your own strengths and avoid judging and blaming yourself. I mean, we can be really hard on ourselves. We can, focus on, what I should have said, or maybe what would have been right, or what would have been helpful. So it's easy to start getting into that self-critical thinking, which also doesn't really help us. Now, the third strategy that I think is really helpful for families to keep in mind, and this is based on several studies that have highlighted the really influential role of family members and social networks in terms of motivating individuals to pursue treatment. I noted earlier, in DBT, we refer to people with BPD and substance use disorders as butterfly clients. They are clients that often do not engage easily. And there's a lot of emphasis on outreach and on trying to engage them in treatment. Several studies have examined the impact of families and the influence of families on engaging their loved ones in treatment. And this research shows that when families increase pressure on their loved ones to engage in treatment, in other words, block your loved one's avoidance, it actually does improve treatment engagement. And it's for this reason that a lot of relational approaches have been used in treating substance use, really to support the individual to engage in treatment. Now, when I talk about trying to engage the person in treatment with some pressure, what I'm not talking about is being critical or judging, but what I'm talking about is confronting your loved one in a calm way, in a non-judgmental way, by directly addressing your concerns is a helpful way. In other words, to put some pressure on and to help the individual not avoid and not deny the problem. Now, you can also assist your family member by providing information and helping them connect to treatment services. You can encourage them to be sober, to abstain, It may be saying something like, I notice you're smoking pot every day, several times a day, and I'm really concerned about your health. And I'm afraid that your drug use is holding you back in your life. I'd really like to offer you support and help refer you to a specialist. I care about you and I want the best for you. So maybe a communication like that. Now, another strategy beyond encouraging people to change is also, or engage in treatment, is also just encouraging them to make changes across a variety of areas. There's a bit of a myth, and I think in particular substance users, that the idea is that, people have to hit rock bottom in order to change. But that's a myth. Change can occur at various points along somebody's journey, and change is influenced by many factors. And a few factors that do play an important role are support systems and external influences. And encouraging change is helpful. It's a helpful way to promote change. Now, you've got to tailor it to your person. And I think it's got to be done in a way that you need to be patient and you need to be persistent. So it means being calm and non-judgmental, but persisting. So ideally, you're going to focus on trying to encourage change on one problem at a time. So break down large goals into small ones. So, rather than saying, get up out of your room and stop staying in bed all day and smoking pot, just manageable small steps that make the person feel less overwhelmed, that make it a little bit easier. It might be, come out and sit with me for a cup of coffee. It may be just a small step. And it's important to be effective and non-judgmental and direct in communicating what you want. So it might be, I really want to spend time with you. You're spending a lot of time alone in your room. Or we really want to help you. We really want to sit with you and talk about how we can help. It's important to us, that you help us by smoking pot outside of the house, for example. I think ultimately we can ask for what we need, but we may not get what we need. And it's important to be able to negotiate. And so it may be negotiating on what level of care this person is prepared to receive, if any. Or maybe it's negotiating on when they would actually start treatment. So there's many things that we could negotiate on, but sometimes when we don't get what we want, that's where we may go next. The next strategy that I think is really important is to reinforce and celebrate all steps towards change, any progress. So positive reinforcement is, of course, really important because it's a great way to boost confidence. We all like to feel like people acknowledge what we've done, that we've made a step towards change, that people have noticed it. It's much easier, of course, when your loved one is engaged in behavior that's really driving you crazy, to notice that behavior. We're much more attuned to the things that are driving us crazy, but really bringing your attention to just noticing any steps that are a step towards non-substance use. So this could be, for example, anything the person's done to not engage in substance use behaviors. Maybe they actually got up that morning and they spent time with you, but they weren't seeming to stand in the backyard smoking pot first thing in the morning. And it might be praising the person, that could be reinforcing, or it could be actually just spending time with them. Often attention is highly reinforcing for people. It could be reinforcing and noticing anything that they've done where they're engaging in any pleasant activities, any non-substance using activities, or any productive behavior where you just notice it. Thank you for putting your cup in the dishwasher. It might be something like that, or any attention that you can give to any positive relationships that they've engaged in. I really appreciate talking to you. It's really nice to spend time with you, maybe just that. And I think that, that's where your relationship is often going to be highly reinforcing. People want to feel loved by their loved ones, and spending time with your loved one, engaging in any pleasant activities together can be really helpful. And so, this may include setting up any kind of family activities that are incompatible with substance use. Now, I appreciate this can be hard, especially the holidays are coming up, and in many homes over the holidays, people are drinking more. So if your loved one is struggling with substances, this may be an opportunity to lead by example, and lead by example where you might create an environment that is not, does not involve substances as a way to support your loved one. So having activities that will support their own recovery is really important. Now, at the same time, you want to avoid reinforcing any problems. So this means avoid enabling behaviors. Maybe, for example, you've just been ignoring the problem. You don't talk about it because your loved one gets angry. Well, that actually isn't helpful. Or maybe you keep giving them money over and over again, but you're not actually sure where it's going, and you think it may be going towards drugs. Or maybe you've just been, kind of making excuses, and maybe you've really been believing the lies, even though in your gut, you just don't believe the lies. So those would be examples of enabling behaviors. They're not helpful. They actually end up reinforcing the problem. It is also important to maintain limits around what limits for yourself around drug and alcohol use in your home if your loved one's living with you. If you do not want drugs in the home, then it's important to maintain that limit. And it's also important to hold your family member accountable for any commitments that they make. So for example, maybe, you ended up picking up your loved one at the police station when they were, found to be drinking and driving, and they swore to you they'd never happen again. And they committed to you that they would go to AA, and they committed to you that if you ever discovered that they were drinking and driving, that you would call the police. But suddenly, you discover that actually they were drinking and driving, and actually you're now hesitant to hold the person accountable. I mean, that's where it's important to, if you said that you are going to hold them accountable, maybe you are going to call the police if you think they're drinking and driving, then it's important to follow through on that. So be consistent with your limits and follow through with your consequences. Finally, overall self-care, I think, is essential for maintaining a healthy and fulfilling life for all of us. And it's important that we look after ourselves. We're much more likely to end up in conflict with our loved one if we don't observe our own personal limits. So it's important to not allow yourself to tolerate behavior that is exceeding your personal limits. I think it's also important to, and it can be really helpful to try and identify what are the things that challenge you most. Maybe what's challenging you most is that, your loved one isn't getting out of bed all day. They seem to be up in the middle of the night. You suspect they're smoking pot in the house in the middle of the night, but all day they seem to be asleep. And that's bothering you. So maybe, an approach to take is to identify if that's something that really is bothering you a lot. See if you can think of what's a potential solution for this. And it may be a solution is I need to observe my limit on this. Or maybe I need to consult with a health professional on how I can address this concern. So figure out what are the challenges that you can identify that bother you most. I think being informed can be empowering, and I think that's an important way to manage your own reactions and care for yourself. And I also think that we all need, we need on deck some short-term strategies at times to deal with our own emotional stress in the moment. It might be going for a walk or taking a time out. It might be calling somebody up, or it may be just tuning the person out, going to take a hot bath. The idea is that on a day-to-day basis, we need ways to renew our own energy so we can deal with the situation. But not only, should we be reliant upon short-term strategies, it's really important to have long-term strategies. And this means figuring out, do you have a social network that you can talk to? Have you got a care plan for yourself? And this might mean, you taking care of your own physical health, not giving up, for example, going out to the gym because you're worried about leaving the home. Or it may mean, taking care of your social needs and talking to people, or drawing upon spiritual care, or considering your financial needs. Because if you're spending a lot of time supporting a loved one financially, that may be draining, and that may be something you need to take care of for yourself. So those are some strategies. I hope they may be helpful to you. And at this point, what I'd like to do is stop sharing my slides and maybe open things up for some questions.
Great. Wow. Thank you so much, Shelley. There's a lot in there. It was only a few slides and so very much information and content. I have a couple of themes that have come up in some of the questions. First of all, people are wondering, what is the role of harm reduction in all of this? Where does it fall in terms of enabling a family member? Is it part of your crisis and safety planning? Maybe you can just speak some more generally about how it fits in with treatment and how we interact.
Great question. My first comment is that the ultimate harm reduction would be abstinence. I'll also say that with people with borderline personality disorder who are already struggling with problems with emotion dysregulation, oftentimes abstinence is, oftentimes rather harm reduction or reducing substance use is extremely difficult, because substances have been a way of coping. And so in treatment, oftentimes, and certainly in DBT, and I can speak to that most knowledgeably, but in DBT, we do push for abstinence. And we push for abstinence because we believe that it will be a more helpful approach to somebody who's already struggling with their ability to regulate their emotions. If substances are there, there's always going to be a pull to use those. And it's much harder to learn skills if you know you can go use substances instead. Having said that, not everybody is motivated to abstain. And so ultimately, you kind of dig where the ground is softest, and you try and encourage people, you express your concern, but it's their choice. And people need to know that, it's important to recognize the autonomy of the individual and empower them to make choices.
Great, thank you. Another question that's come up a lot is, how do you engage with somebody when they're sober versus not sober, or specifically when they're not sober? So a couple of examples. Somebody asked, my loved one will make all kinds of commitments to follow through, but if they say these things when they're not sober, I guess I can't really believe what they're saying. So, do we pick and choose the times when we have these conversations?
I think it's always helpful to consider timing when you're having an important conversation, or a sensitive conversation, or a conversation that's likely to, increase defensiveness in somebody. I think that the question about whether can you have a conversation when somebody is not sober, I would say it depends. One, it depends what we mean by sobriety. Some people might have had a drink or two or smoked a joint, and some people may be so intoxicated that they're nodding out and they're not capable of processing information. So I think you'd want to consider, how capable are they of processing information, acting on this information, even if they not retaining it, but can they act on it in the moment if I'm asking them to do something? So sometimes, some people may be beyond the ability to take information in if they're so cognitively impaired by the substances. But, even somebody who's really intoxicated, is really drunk, often they can respond, they can be responsive.
And is this something that then we would feel like we could actually hold them accountable for something that they've committed to? Do we need to really sort of play it by ear and determine whether they really were able to engage in that conversation cognitively, and would they even remember it?
Mm-hmm. I think it very much depends on what's being asked, but I think that if the issue is that you're wanting to have an important conversation with somebody and you're, making a request of them to do something that's important to you, I think it's probably helpful to have that when they're in a sober state. That doesn't mean that if somebody walks into your home and they're drunk and you just want to tell them to please go to bed and, stop making a mess of the kitchen. Of course, I would make that kind of request. And it doesn't matter if they don't remember it the next day. In the moment, it's important just to tell them, just please go to bed, you're drunk.
So timing, context, and the goal of the conversation.
It very much depends on many things.
Right. Okay. Thank you. Another question that came up around engaging with somebody when they're not sober was around what you were talking about, engaging in activities together and that relationship building piece. And so there were questions coming in like, is it still helpful to do this if maybe the person is only interested in engaging activities with me when they're not sober? Is that still helpful, or should we be trying to build this as part of the sober relationship?
Oh, I think absolutely. I think absolutely. If your loved one is engaging with you when they're not sober, absolutely, I would do lots of that. I mean, I think what often happens with people who are using substances, the world gets very small because all their activities revolve around substances. And so what's really helpful is to help your loved one build a life that's not around substances. So, perhaps you go on a long bike ride with your loved one and you're out biking and, your loved one is sober. Fantastic. They've had this pleasant experience that doesn't revolve around drugs. And that's really beneficial. The more you can help them build in their life pleasant experiences that don't involve substances, all the better.
All right. Thank you. We're very close to 8 o'clock. One other question that's coming up again and again, and I'm sure you're very familiar with it, is, how do I deal with a family member who simply denies that their substance use is an issue? Just outright denial.
Okay, perfect. And going back to, I think, what I spoke about earlier, denial is normal. If you're substance using, it's very normal. And so radically accepting that that's part of the disorder, to lie. People lie when they want to hide something, often want to hide something because there's high levels of shame, or maybe they're worried about the loss of their relationship with you. I would say that when somebody's denying or minimizing, this is where it's really helpful. And this is where, I think 2 steps. On the one hand, you're moving in with a lot of empathy and a lot of understanding. And at the same time, you're not avoiding the conversation. Even though they're denying, don't engage in denial with them. And it may be they're saying to you, everything's just fine. I feel better now. Meanwhile, it's not fine. Directly saying, I'm really concerned. I know you spent the past week in bed. I know you want things to be fine right now. I can see you want things to be fine. And I'm concerned that you've been really struggling with using pot every day, and it looks like it's hard to get yourself out of bed in the morning, and I really would love you to get some help. So don't avoid.
Sounds like a very tricky sort of balancing act between the leaning in with compassion and empathy, and really being truthful, genuine, clear communication, and maybe observing the limits piece as well. Right. Okay, thank you so much, Shelley. If I could close with one last question. The title of your topic, or perhaps not in the title, but in the description of your talk, talked about recovery. And a number of people have come in and asked, is it really possible? Is it possible to recover from BPD and substance use? This feels like such a complex piece to untangle, and you've spoken about the complexity of treatment. Is this a realistic goal, and what would recovery look like?
First of all, I want to say absolutely it's possible. Absolutely it's possible. I've been working at the Borderline Personality Disorder Clinic for now 27 years. About 40 to 50% of the clients that we treat have substance use disorder problems. And I can say confidently that people are recovering. And I've had the pleasure of working with many individuals and seen tremendous work that they've done through treatment, and the benefit and the ability to recover from using substances, and really, I think importantly, have a life that they want, really build a life that they feel proud of.
It's a beautiful definition of recovery. Thank you. Thank you so very much, Shelley. Thank you to our audience for all these wonderful questions. We have brought this to you from the Sashbear Foundation. If you are interested in making a donation to support our work, please go to our website, or the link that Tricia will put into the chat. And I hope you have a wonderful evening. Thank you again so very much, Shelley, for having been with us this evening.
Thanks for having me.
Good night, everyone.